Campylobacter is a gram-negative bacterium that is spiral-shaped, motile, and a non-spore former. It has a single flagellum at either end or both ends of the cell and moves in a corkscrew-like motion. It requires limited oxygen for growth, making it an obligate microaerophile, and grows within a narrow range of temperatures between 37 and 42 degrees Celsius.
Campylobacter jejuni is a species of Campylobacter that causes most human cases. Symptoms include diarrhea, cramping, severe abdominal pain, and nausea and/or vomiting. Campylobacter jejuni has been the leading diarrheal illness in the U.S. and is a large problem in non-industrialized countries where water sanitation and food regulations are not adequate. On a yearly basis, Campylobacter jejuni is known to affect 1.36 million persons but may be underreported because patients may not seek medical care or stool samples cannot be cultured.
Confirming the presence of Campylobacter jejuni can sometimes be difficult. Major issues of detection arise from their fastidious nature, special conditions for growth, and use of selective media. In addition, it has the ability to adapt and alter its physical and biological characteristics when subjected to pressure from environmental factors. Health officials who are alerted of potential Campylobacter infections will collect stool samples from the individual that is infected and send them to the laboratory, who will follow official protocols for handling and culturing this microbe. Campylobacter grows on sheep blood agar and other agar media with limited oxygen.
Campylobacteriosis is a zoonosis, meaning that transmission is from animals to humans. Contamination occurs most often in animals from feces during slaughtering. The main route of transmission is typically foodborne via undercooked meat. Water can also be a source of transmission from direct contact with contaminated water during recreational activities. Raw or contaminated milk has also been proven as a source of transmission. A reservoir is any person, animal, plant, soil, or substance in which an infectious agent normally lives and multiplies. The reservoir serves as a source from which other individuals can be infected. Chickens and turkeys are the most frequent sources of Campylobacter jejuni. It is most commonly found in the intestinal tract, especially the ceca. A major issue that arises with chickens and turkeys are that they show no sign of illness, so the infection goes unnoticed. Stool samples are the only indicator of Campylobacter jejuni infection. Cattle are the second most frequent reservoirs for Campylobacter jejuni. Campylobacter can be transmitted if an udder is contaminated from contact with manure or if there is improper cleaning of the teat before milking. Consuming unpasteurized milk increases risk for illness. Pets are also reservoirs for Campylobacter jejuni. Mishandling of feces and improper hand washing is the main cause of transmission.
Challenges in the food industry include poor sanitation, improper handling and care, lack of symptoms in chickens, difficulty in locating transmission sites, and improper cooking of food. Preventive measures include properly cooking meat, proper storage of meat and raw produce, good sanitation practices, and implementation of necessary food safety programs.